Hi, this is Steve Berger. I direct the science for GIDEON, but I'm also a user of GIDEON. And today I'd like to tell you what I need as a user, and the solutions that GIDEON has come up with to solve my needs. The most important part of GIDEON for people out in the field. I mean, I'm a clinician, I treat patients, I do diagnosis, I also work in a laboratory and I identify pathogens. And I speak to students a great deal. And from my standpoint, teaching is the most important aspect of what I do. And I need a program that will give me printed media, charts, and PowerPoints and things for publication. And I'm going to show you how I generate those things in my GIDEON from day to day. Let's get to Explore. And one of the most important teaching aspects of GIDEON is the ability to compare diseases, compare drugs, compare microbes. We do this all the time. This is not limited only to infectious disease, but this is the method of teaching students and interns and even specialists in the field. For example, let's say that I would like to compare the characteristics of shigellosis, salmonellosis, and campylobacteriosis. Of course, all diseases which are associated with diarrhea. So we push on the compare button over here, and let's say as we've said, we're interested in comparing shigellosis, salmonellosis, and here we're comparing the clinical features. We could compare the bacteriology, which we'll come to later, and other features, and even the treatment, salmonellosis and campylobacteriosis. And you see, having pushed the names of the diseases, they're here in a nice little chart. And on this chart, we see that some diseases, one of these may often produce a certain symptom, whereas another is rarely produces. With the option of either having this in words, and users have asked us for this, or in actual numbers, what percent. And you see here we see what percent of cases would have any specific set of symptoms. There's no limit on the number of diseases that can be listed. And at the bottom here, as for everything in GIDEON, you have the option of generating a PDF file of what you're seeing on the screen, or either generating or sending a PDF to a colleague or what have you, or preparing handouts for students. Below the signs and symptoms is also additional data, some other written text that might help contrast between these diseases. So let's try another set of lesser known diseases. First, we can eliminate the ones that we already have on the screen by clearing. And by the way, there are many other places in the program at which we can mark off diseases for comparison. I'll show you that in a little while as well. But let's take a few things that you've heard less of, perhaps. These are the South American hemorrhagic fevers. There's the Argentinian, the Bolivian, the Brazilian, and the Venezuelan hemorrhagic fevers. And for many of you, these are not household words. These are things you haven't heard of before. And there you go again. We're comparing them by numbers. The clinical features, of course, of those four diseases. A bit of additional text that might be helpful in differentiating among them. Now, these, as some of you may know, are all what we call arenavirus diseases. And there is one that's better known to infectious disease people these days, and that's Lassa fever. So let's compare these to Lassa fever. That's another arenavirus, in case an African arenavirus. And there you go. You're comparing the African, classic African arenavirus to the South American arenaviruses. There are diseases in GIDEON, if this makes you uncomfortable, it should. There are diseases in GIDEON that are just not that well known. We make an effort to have every disease, as rare as it is, we have every disease. For example, Brazilian hemorrhagic fever, I believe there have only been 3 cases described. There's a variety of Lassa fever in Africa called Lujo disease, which is in GIDEON. I won't put it on the screen now, but it's also only 3 cases have been described, and we've got them. And there are diseases, of course, which are very current. One of the nice things about GIDEON is even the screenshots you're looking at are already old. GIDEON is updated in real time. And so let's clear this and put in one more set of diseases. And having said that we have the rarest diseases, we also have what we might call the day-to-day popular diseases, the ones you're reading about as I give this demonstration. Let's put a few of those in. So let's put in Mpox, which was formerly called monkeypox, versus smallpox, varicella, which is chickenpox, vaccinia, and maybe 1 or 2 others. So there's here smallpox. You may not know, by the way, that chickenpox is not named for chickens. And GIDEON will tell you what it is named for, by the way. It has the etymology of all, for all it's worth, all bacteria and diseases and what have you. So we've got monkeypox, smallpox, varicella. Let's put that one in. Of course, a common disease. And vaccinia, or cowpox, which are related. And throw in, just for fun, something you probably have not heard of is tanapox. Tanapox. And what's the difference between those? You see, and again, in terms of descriptive clinical features, rarely occurs, often occurs, or again in numbers, words or numbers. And we have users that prefer to use either of those. Nice little chart, give it to your students and what have you. Let's clear those. And again, the current diseases, I think everybody who's watching this has heard of COVID-19. So let's compare COVID-19. This one comes up all the time, by the way. This is like a standard chart given to trainees and students and what have you. SARS, which was a predecessor of COVID. MERS, which is another common infection, lesser known but extremely dangerous. And, we can put in here influenza, because that comparison comes up essentially every place in medicine. What's the difference between influenza and corona? We hear this all the time, influenza. And of course, these are very practical, nice little, again, printouts and handouts. And here we go. Another place in GIDEON that I find extremely useful for this and other features, which you'll see, is a place where all diseases are listed. It's just very handy to use. This little A to Z button. So let me list all of the diseases in one place. And here, you see these buttons here? I can click them off as we're just doing on the screen. But instead of writing them down, I can just click off, I want to compare that and that and that and that. And it's quite convenient. And the same applies also to comparing all drugs, comparing all the vaccines, bacteria, and what have you. And yet another place where this comes up, and again, it's just very practical, there is a diagnosis module, of course, in GIDEON. And having made a diagnosis, we can click off to compare on the spot. So let's say where we've put in a patient, this is a patient diagnosis module, we'll put in some signs and symptoms. So it's a fever, and pneumonia, you see, and you see I'm clicking off a very obvious kind of diagnosis at this point. And having put in, by the way, as a sign and symptom, additional features that you might want to click off. Having said pneumonia, GIDEON is saying, well, if we're already in pneumonia, what would you like to say about the chest, cardiopulmonary, what have you? So here we have a list of diseases that's coming up for diagnosis, and let's say I want to compare them. Here's again our comparison. You see, so we can compare right on the spot. So I'm going to compare bacterial pneumonia, coronavirus infection, influenza, and you see, and then push the compare button, and the comparison will come up again. So let's go back to our again our compare option. Clear the table of what we've been putting in, and we'll compare a few drugs. What would we like to compare among the drugs? And here we're comparing spectra. This drug is good for A, B, and C, and a similar drug is good for B, C, and D. This is what we're going to do. So here's a very popular one, albendazole. What is albendazole good for? What is ivermectin good for? Good for meaning in terms of spectrum. And praziquantel. And this comes up very frequently. And there you go. And again, so the spectrum of albendazole is here. You see certain parasites, many of which you may not have heard of, versus ivermectin versus praziquantel. It goes on and on and on. I find many of my colleagues, by the way, are pasting this exact chart onto the walls of their clinics and offices. These questions just come up so commonly, and it comes up again in lectures. This is a wonderful thing for lectures. This lists not only the spectrum of the drug, but which are the drugs of choice? Is it the drug of choice for something, or is it used in combination, or is it used, you see, and so there are various icons which have that information as well on the same chart. Is surgery required in addition to the drug itself? I'll put in another set of drugs. Let's see, we want to know the spectrum. These are antibacterial drugs now, probably. What is the difference in the spectra, again, of prulifloxacin versus fusidic acid, pristinamycin, and troleandomycin? Fusidic acid. Now, of course, I'm doing this on purpose because you never heard of these drugs. I think many of you have just never heard of them. And there's a point to be made about it as well. Pristinamycin. And troleandomycin. And the point here is that GIDEON we make every effort to have every drug in the world. Not just FDA-approved drugs, not just drugs used in the United States. There are uses of GIDEON in just about every country in the world. In my own hospital, fusidic acid was a very popular drug, wonderful drug, by the way. It's not used that much anymore. And pristinamycin was mostly used, it was known as the French erythromycin, I believe they used to call that. But French meaning it's not that used, if at all, in the United States. So we've got every drug, and having gotten the drug, here again, the spectra of the drugs. And we'll put in two more along the same lines, things that are not that well done. I'm stressing here things that are not well done. If you want to look up the spectrum of amoxicillin versus cefalothin, I think you wouldn't get into your computer probably. GIDEON will do that, but I know that it's something we use every day in my hospital, perhaps. Here's another example of drugs that are not that widely used, but are extremely important in some sectors of, again, infectious disease. One is cidofovir, and the other is ribavirin. What's the difference? And this does come up in people doing virology and specifically treating a rather interesting set of viral diseases. And this is the interesting set of viral diseases we're talking about. So cidofovir is good for these, and ribavirin is good for these. And there is a point to be made here. One other I'll show you is comparing bacteria. This is extremely useful. And again, bacteriology laboratories will have this kind of chart on the wall, believe me. Charts from GIDEON, by the way, comparing the phenotype the phenotypes of bacteria. So let's get in there. And we'll take a group of, you've heard of Clostridium. So what is the difference in phenotype of Clostridium difficile versus Clostridium botulinum, perfringens, and tetani? So let's go down to botulinum. GIDEON has over 2,000 bacteria, so this goes a bit slower as we select these things. And the number here, by the way, there's one new organism in GIDEON added every week. These one organism in human beings published every week, about 50 a year, which means that books are always at least a year or two behind, and even systems used in laboratories are behind. By the time they can design a system to identify bacteria, it's taking time. But GIDEON's got the phenotype of the bacterium the day it's published. Perfringens and tetani. Instead of going all the way down to Clostridium tetani, I just wrote tet. You see, these are very interactive, again, data entry systems. And there you are, nice little chart for your anaerobe laboratories. And just as for bacteria, additional characteristics of the organisms, the odor, the color, things that are not necessarily quantitative. Just another interesting chart. The number here is infinite, just given the size of the population of bacterial species. But let's put in the tuberculosis-related bacteria. There's something called Mycobacterium tuberculosis complex, which consists of tuberculosis, which most of us, I think, do know. The bovis, of course, bovis. Africanum, Candidii, and Microti. I even forget these. Candidii and Microti, the tuberculosis complex. And there you go. One of the most useful in my world modules of GIDEON is called the fingerprint. For over 100 years, there have been people organizing diseases according to what's called descriptive epidemiology. Here we have, explore diseases, and there's our fingerprint. And what does that mean? Let's say I'd like to list all of the diseases that match a certain agent or vector or vehicle or reservoir or, of course, country. Example, what are the flaviviruses? This is all the flaviviruses. So we'll get here, flaviviruses, or all of the trematodes, or all of the cestodes, or all of the arenaviruses, as we did before. So there are 20 flavivirus diseases in GIDEON. And having said that, what are the flaviviruses that are transmitted by mosquitoes? And you're familiar with the concept, but how many are there? Again, diseases. So mosquitoes, and how many of those are there? And there are 11. What are the flaviviruses transmitted by mosquitoes which have a reservoir in birds, avian reservoir, bird? And there are 6. And how many of those occur in Brazil? How many flaviviruses transmitted by mosquitoes found in birds occur in Brazil? Let's see what we're doing here. This is extremely useful, a simple teaching tool, very effective teaching tool. There are 3 of those. Again, flaviviruses transmitted by mosquitoes, reservoir in birds in Brazil. What are the diseases that you will get from eating sushi in Taiwan? What are the trematodes that you will get from eating sushi in Taiwan? What diseases are found in dogs in the United States? What viruses are found in dogs in the United States? Again, transmit zoonotic viruses, because these are diseases of people. an extremely useful teaching tool. So let's try another one of these. Trematodes. What trematodes, these are just so much fun, are found in snails in the United States. These again are human diseases. And there you go. There are 7 trematode diseases of people in the United States which are found in snails. I show you again this list for obvious reasons, because many of you are in the United States, and did you know that you can get phyllophthomyces or paragonnomyces or nanophytiasis or metachliasis in the United States? And I suspect, again, these are not household words in your clinic, if you will. The last module that I'll show you in GIDEON, the last interactive module, we call Visualize. Visualize, as the name implies, is a way to look at data visually, graphs, charts, maps, and what have you. Many of the map features are interactive, but we just don't have time for them today. But I'll show you some of the graphs. There are over 39,000 graphs in GIDEON. It's up about 1 million data points in those graphs. And here we have the option of comparing graphs across diseases or across countries or mix and match. I'll show you what I mean by that. I started off this session by talking about comparing Shigella, Salmonella, and Campylobacter. Well, let's look at Campylobacter in the United States. This is just a convenient way to code down the number of graphs that we're interested in, because there are so many. So we're going to put that in the chart. You see, we're going to type on that one. Versus shigellosis versus salmonellosis. So I want, I've got Campylobacter. Shigellosis cases, salmonellosis cases. Or we could compare that, so everything you're seeing on the chart. So let's generate the chart. And again, I'm comparing the incidence, the number of cases per year of those 3 diseases, and some additional related text will be also shown when you generate the chart. And these charts go on and on. I would stress again that you can compare between countries. Let's say, what is the rate of Lyme disease in the Czech Republic versus that in the United States and France or whatever other countries you need. Here, of course, we wouldn't be comparing the numbers of cases. The populations are different between France, the United States, and the Czech Republic. So you have the option of choosing per 100,000 and making that sort of chart. I'll show you just one other very useful kind of chart you can use, again, in this module, comparing graphs. Let's go to some other diseases in an interesting country. So let's say I want to compare information about measles in Mozambique. And the question is, get down to see what's available on that subject, and here we are. And let's look at the vaccine coverage versus the rate of disease in that country. The obvious question being, is there some possible relationship between a vaccine uptake and how much of that disease is actually occurring in the country? And well, what do we have here? And let me just scroll down a bit. And you see here are the rates of measles, you see that, which have been decreasing. And the vaccine uptake has been increasing. You see, in the same years, essentially. Isn't that interesting? Now we can imply that this perhaps cause and effect, but we can't prove it. But this is a way that you can again, show that perhaps the vaccine works, or whatever point you'd like to make. And there's no end to the number of, again, charts we can show this way. I'm going to stop here. When you're exploring GIDEON, just have this in mind. What can I do using the text in GIDEON? What can I generate for my students or my trainees, or to help me publish data or prepare printed media? And I hope you, among other things, to just have fun using these tools. I'd like to thank the GIDEON guys who are creating more and more of this magic even as I speak.